Good afternoon and welcome to another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. I'm Eric Marsh. Appreciate you spending some of your time with us again on this Friday afternoon. Joining me once again, Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health.
Thank you.
How are you today?
Great. Glad to be here.
And sitting in for our Dr. Jetmore,
Yes.
Christine Stinson, Executive Director, Wayne County Health Department. Always glad to have you here.
Yeah, always glad to be here.
Appreciate the time from both of you. Since you're the guest, even though
Yes, yes.
a semi-regular guest, we'll start with you. Give us a little rundown of what the week has been like. You listened to the news and numbers seem to be pretty low.
Numbers are looking really good. Quietly optimistic that we're going to maintain some of these lower levels as we move through the summer months. We're under 3% right now with our positivity rate. Really wish that we could push through on those immunization rates and get those up above 40%. We just seem to be kind of stagnant. For 12 and older population, we're just under the 40% mark at 39.9%.
Reed Health, things letting up, less of a COVID population in your facility?
Much less. I think we only had 2 known positives in the hospital this morning. We've not been that low for, I'm not sure when. It's been a long time.
Been a long time.
We've now kind of gotten out of the phase of having several people on ventilators. Haven't had at all in the last 5 days or so. So that's very good news. And yeah, things are going really well. We're again trying to figure out how to get our vaccination efforts into a more effective mode.
Mm-hmm.
It's clear that from the public perception standpoint, a mass vaccination center approach isn't going to meet everybody's needs. And we have been experimenting with doing it, particularly in our pediatrics office, which I've referred to before as a very much more sort of vaccine accepting culture. And the patients who come to the pediatrics office, it's talked about a lot more, encouraged a lot more, and they do the same with the COVID-19 vaccines. But I think the thing that we're finding is that more people are interested when their own doctors have it available and specifically address it. So that's what we're going to try to do going forward. We want to get it into all of our primary care offices, but it's a little bit challenging because of the unique storage and handling requirements of the vaccines, and the fact that we have to have systems built so that people can register, we can have the workflow on our electronic health system, and that information gets fed back to CHIRP, which is the state registry of vaccinations. And those aren't really built right now for our information system, so we're still using the state system, mm-hmm. but working into different systems makes it very much more complicated. Yeah. So there are a lot of hurdles yet, but we think we're going to get there.
Okay. You've mentioned the mass vaccination sites won't
mm-hmm.
work. Are you still doing things at the Coleman Center, or have you completely wound that down in front of the fair, which is going to begin a week and a half or something like that?
We plan to stay at the Coleman Center at some level for the indefinite future. I mean, okay. That won't be forever, literally. At some point, it will be blindingly obvious to everybody that sort of approach is not necessary at all. But the thing that we want to make sure we keep our options open, because we don't know what the future holds. We don't know if there will be more resurgence. We don't know if variants will rear their heads and become a problem. We just don't really know all these things for sure at this point. I mean, I think scientifically there are encouraging signs emerging as more data is developed and analyzed and publicized. But for right now, we want to keep all our options open. So we will continue to be at Coleman. It's just not on that grand scale that we had been. Starting last Thursday, we dialed that back to 3 half-days a week. Thursday mornings, Friday afternoons, Saturday mornings. And that's what we will continue for the indefinite future. However, you mentioned the fair.
Mm-hmm. I did.
And the I guess it's I don't know which group, but it's the 4-H fair, and there are a lot of activities that normally would take place in the Kuhlman Center, things that are not best done out of doors, crafts and
there's a lot of exhibits that
individual
take that
projects.
room. Yes,
absolutely. So, we don't want to get in the way of that. It's obviously the demand for vaccine is not such that we've got to keep in that space and be in their way. So we've made an arrangement that we will temporarily not use the Kuhlman Center for vaccinations during the period of the fair. Actually, the pause, as we're calling it, at Kuhlman, the Kuhlman pause will last from June the 12th until July the 8th. That the fair doesn't go that long, but we do want to leave them time ahead of the fair for us to get out and them to get their things set up.
Right.
And on the back end, the fair ends about 10 days, 7 or 8 or 10 days before the July 4th holiday. And we anticipate that the demand for vaccines will be even lower over the holiday period. So we're not going to go back in until the Thursday after the July the 4th holiday. So that happens to be July the 8th. I know that's a convoluted explanation, but basically, Kuhlman Center won't be doing vaccines between June the 12th and July the 8th. However, we will continue to do vaccinations in a variety of ways. We have them available at our urgent cares. We are doing them at the pediatric center. We also do them at the Ready Care in the Meyer store, and people can schedule for those. So there won't be an interruption of availability of vaccines, at least from us, and I know that your team will continue to do them too at some level. And in addition to that, we've been talking to Chris Simons from the Health Department about collaborating on doing, making vaccines available at the fair outside of the Kuhlman Center. So Christine is going to have her team there with your van, and we'll be there.
It's more than a van.
It's what do you want to call it?
I call it
mobile
unit.
The mobile unit. That's a more accurate description.
Yeah.
And we will also
Cool
have we will also have a couple tents set up with the ability to do some vaccines there.
Yeah.
Okay.
Now that Christine has access to the Pfizer vaccine, it gets a little bit less specific about who's providing which vaccine. It really is about who has more access to enough vaccine. We transferred some vaccine to Christine's team this past week because you were low on the Pfizer in anticipation of some activities you were doing, and so we happen to have quite a bit. So that's the level of cooperation we have. But we're going to cooperate on the fair to actually try to get some walk-by vaccinations in.
All right. A great place to at least provide people with some information.
Absolutely.
They are looking at that.
Yeah.
And we will want to do Johnson & Johnson there, I would think. I'm not sure how much J&J you have. I have, at this point, a few hundred vaccines and can get more if we need it.
Yep.
Talk about, before we move on to some questions, and we're taking your questions on our Facebook page or at Twitter, at WCTV Info. You can send your questions in. We're going to start to get to those in just a little bit. We had a few that were left over from last week that we didn't get to, so we'll start that parade a little bit earlier today. But talk about, from your standpoint, what people need to do in order to be vaccinated through the health department.
Through the health department, we have found, just like what Dr. Huth is, that the mass vaccination site really wasn't efficient anymore. We worked through that period. So we've moved everything, testing and immunizations, back over to the health department building at 100 South 5th, at the corner of South A and South 5th. And we have vaccines now Monday through Friday from 9 to 4. We take walk-ins. We take our last walk-in until 3:30. But you can always make an appointment at our vaccine clinic at rshot.in.gov. We will be at the fair, and you can schedule an appointment there. There will be you'll see that on the rshot.in.gov site, or you can walk up and do that. We'll have Pfizer and Johnson & Johnson there. We're not going to try to bring Moderna out there, but our clinic will still be operating at the health department that whole time too. So we'll have both sites working in tandem the week of the fair. So that we'll be out there from the 16th through the 26th at the fair. Every day that the fair is open, we'll have a presence out there doing vaccines. We're also doing a school clinic at Centerville on the 12th. You'll be able to sign up for that as well at ourshot.in.gov. So when you hit Wayne County, I think there's 13 sites now that you can sign up in Wayne County to get your shots, including all 3 CVSs or 2 CVSs. So there's lots of different options out there. I'm not the only game. Read is not the only game. What works with you, do it. You know, it's whatever is the most convenient. Do that. So the Centerville will be at the Centerville Junior High School, and that's from 10 to 2. It's open to the public. It's not just for school kids, but we decided to come to the school to make it the most convenient for parents to get their school kids 12 and up vaccinated. So we'll have Pfizer at that site. We'll probably bring Johnson & Johnson too for parents.
And that's the 12th, you said?
That is the 12th.
Okay.
And I'll send you guys a flyer, so you'll have a flyer. I should have sent one so you guys would have one for the show.
No problem. Centerville Junior High School, June 12th. Give me the time again, if you would, please.
10 a.m. to 2 p.m.
Okay. 10 to 2, register ourshot.in.gov.
We will take walk-ins.
Okay. Sounds good. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Sitting in for Dr. Jetmore, Christine Stinson,
Yes.
Wayne County Health Department Executive Director, and Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. Let's start with a couple of questions. How are the long-term care facilities doing? Any outbreaks? That seems to normally be...
Christine may have more information than I do. I have a little bit of information from some of the surrounding counties, which isn't really Christine's focus, but really they've been very good lately. There was a small outbreak at a long-term care facility in Union County about 10 days ago, but it did not get very severe, and I think that is pointing to the fact that a lot of the residents especially, not enough of the staff, but many of the staff are vaccinated, and that seems to really kind of help tamp down the severity and the size of these outbreaks. That's the only one that I know of in the last few weeks, really in a month or more. But there have been outbreaks in other long-term care facilities around the state, so I think that the challenge with long-term care facilities is getting staff vaccinated. I've referred to this before. I think when it's all the smoke clears and all the data's in, everybody analyzes it, it's going to be very like the situation with influenza, which is that you can vaccinate virtually every resident at a long-term care building against influenza, but still have outbreaks, but they pretty much go away if all the staff get vaccinated. And I think it'll be the same thing with COVID-19. Although the problem with one of the issues with long-term care is not just the fact that staff are relatively reluctant to be vaccinated. I mean, I think typically they're in the 40 to 50% range now. And there's quite a bit of variability around that. But in addition to that, there's turnover. There's new staff who may or may not have been vaccinated previously. There's turnover of residents. And so you always have a little undercurrent of people who are vulnerable.
Additional information you might have?
No, he summed up exactly what we're seeing in Wayne County. Haven't seen an outbreak in quite a while. We do work with the long-term care facilities. When they get new residents that haven't been vaccinated, we make sure that they have doses to give any new residents. So at least all the residents get vaccinated. But like Dr. Huth said, it's really the staff that are kind of a leading issue there in trying to get them to have 100% vaccination rates with their staff.
Let's get a couple more questions in. I received my COVID vaccine in March 2021 at the Reed site. I did not receive a verification of completing that task. Where can I go to receive a copy verifying receipt of my vaccination?
They can call the health department, and we can push that verification code back out to them. So if they call the health department, 765-973-9245, and I think it's option 2 for the clinic. They'll be able to look them up regardless of where they got their vaccine from, and we'll push that verification back out to them.
Nice.
There's actually a little electronic certificate that you get, I think, which is what you're talking
Right.
about.
You
That's
could-
something that is very handy to have.
Yeah, if you don't want to do that through the Indiana Access portal, you can navigate your way through that, and there's a tab on the Access website for COVID vaccinations, and you go into your own portal, you put your information in. That's a great thing to have, because not only is that your verification certificate that you get, you'll get exactly what day you received each one of your doses. So,
It's good that you've been tracked at least in that way.
yeah.
If you lose this, you can get this back. Okay, we are taking your questions on Facebook as well as on Twitter. Let's get another one in. Are children 12 to 18 having temporary side effects from the vaccine as some adults have had? And obviously in adults it has ranged from sore arms to maybe some slight fevers, things of that nature. They're beginning to vaccinate more kids. Are they seeing the same things?
I'm hearing that the 12 to 18, 12 to 20 really are not having as much side effects as adults had. But
We talked to Dr. Bill Black on the phone last week,
Yeah.
and that's a great question we could have asked him. He would certainly know. I'm not aware of kids particularly having more intense side effects than what adults had. I'm sure they have some. Now, this wasn't the question that was asked exactly, but I think it's good to acknowledge that there is a lot of discussion now about whether teenagers in particular might be prone to get a temporary, minor, non-life-threatening inflammation of the lining around the heart after COVID-19 vaccination. And some people had speculated, as a cardiologist did to me, that they wondered if it would be more the Johnson & Johnson vaccine doing that, because the Johnson & Johnson vaccine is what they call viral vectored. It's actually an inactivated virus, that not the COVID-19 virus, but a carrier virus, a chimpanzee cold virus that is used, and this inflammatory pericarditis and sometimes little myocarditis, which is inflammation of the heart muscle itself, is classically a common thing after certain types of viral infections. And there was early speculation of that nature, but I think that the association actually seems to be more with the mRNA viruses, Pfizer and the Moderna. Not really sure what's behind that. I think the data is not really clear whether that's really happening at a rate that exceeds what the background rate would normally be in the population, but it's an area of intense focus and study right now. But what is clear from it is that there have been no deaths from it. That's been, people recovered from it in the normal fashion, did not need any particular treatments and so forth. So it does not appear to be severe, but it makes everybody worry that that's something that affects the heart even temporarily. But that's not a reason not to get vaccinated, and then the CDC and the FDA still encourage, teenagers to get it. It's just we now need to inform people that this is a possibility. So that's in the literature now that we give people.
You're watching Ask the Doctors on WCTV
I
Channel
should
11.
throw in, we have not seen this here, to my knowledge. So it appears to be very rare.
Okay.
Yeah.
WCTV Channel 21, streaming on Facebook Live. We are taking your questions on Facebook as well as on Twitter. We have Christine Stinson, Executive Director of the Wayne County Health Department here. And since she's here, and since, I'm not sure whether summer is here. It's meteorological summer, but I don't think technically we're into summer yet.
It's hot. It's hot today. Summer in my eyes. I turned the air
told it
conditioning on.
yesterday, but
It is starting to warm up. People are getting out, and,
Yep.
and one of the things that I've seen that I want to ask you about, it's a little off the beaten path from where we are, but I'm going to take advantage and ask a couple of questions here.
Sure.
I've seen flipping through on just kind of catching a couple of quick news things, concern about ticks. And mosquito infestations this year. Obviously, people are talking cicadas, but I don't think they're going to hurt anybody. But talk a little bit about why there's that concern this year about ticks, and what are we seeing, if anything, in this particular area?
Well, I'm glad that you brought this up because it's wonderful to talk about something other than COVID. And tick-borne diseases and mosquito-borne diseases are issues that we do see in Indiana. In particular, I come from northern Indiana, and northern Indiana is endemic for Lyme disease, which is a disease that's carried by ticks. Down here, it seems like everyone thinks that somehow we're not susceptible to Lyme disease. And when I delve into things, I was like, wow, it's hard to find any data on what Wayne County's Lyme disease population, or what do our ticks carry. So I did reach out to the state and got an intern to be doing some surveillance in Wayne County this season to do some tick drags, tick counts, and testing of the ticks, which it's hard to do. It used to be if you found a tick, you could mail it off to Ball State and have that tick tested as any citizen. It's hard to find laboratories now that do that kind of testing, and the state doesn't do it anymore, so it's on your dime to do that. And I could talk for an hour about ticks, so I'll try to condense that down. Anytime that you're out and about, especially in a wooded area, you're going to be doing some hiking, you're going to be outside of a well-manicured yard, you need to be checking for ticks. You need to check your children, you need to check your animals, for ticks. Check in the hairline, check in the creases, behind the leg, in between the legs, in your belly button. A lot of times you'll get ticks attaching in those areas. And you need to remove that tick and then watch for symptoms after you've been bitten by a tick and removed it. You usually need to have that tick attached for a period of time for that disease to be transmitted. So if you're out, you go hiking, you come back, you take a cleansing shower, and you check very carefully, and you find a tick and you take that tick off, the chances of you getting Lyme disease or any other tick-borne disease from that attachment is very low. But if you wait 24 to 48 hours, your chances increase in being that Lyme or another tick-borne disease to be transmitted to you. So you want to look for symptoms after that: headache, fatigue, flu-like symptoms. Sound like anything else? A lot like COVID. But with Lyme, a lot of times, and I think it's upwards toward 70 to 80%, they'll develop that bullseye reaction where they'll have a rash that looks like a bullseye. And that's very telltale of Lyme disease.
Okay. I'm glad I asked. I learned a lot, and I'll be checking my belly button more often.
Check your
these
belly
days.
button. I like to
Something
check
do.
my belly button just daily for the fun of it.
Okay. You're watching Ask the
whereabouts,
Doctors on Whitewater Community Television's WGTV Channel 11. That's a whole nother show.
Another show.
Taking your questions. I guess if you get off the beaten path a little bit, maybe we'll travel that road with you. We've got a couple more questions. Let's see if we can get a couple more in, and then I'm going to throw another one out this way. So let's see what we got. Is this COVID-19 vaccine something that has to be done yearly? I know that there has been that conversation. I don't know that we've actually heard a final yes or no.
we have not yet. And
Yeah.
I would say that Dr. Jetmore and I for some time have been speculating that it probably would be because of what we know about the rate of mutation and new variants and stuff like that. And that is what Dr. Fauci has been saying. That's what the other government officials. It's what the Moderna and Pfizer CEOs have said, and virtually all the vaccine makers are working on boosters or versions that can better cover variants, and they're working on processes to improve the rate at which new versions can be developed, so it doesn't take months and months and months. And you just, in that case, you're just way too far behind the 8 ball at that point. But having said that, in the last couple of weeks, I am detecting a significant number of voices, not fringe voices at all, but people, knowledgeable experts in other parts of the country and so forth, who are saying they're not sure. They're beginning to doubt that, because for a number of reasons.
They're beginning to doubt that it will be yearly?
Doubt that that booster shots will be necessary at all is the kind of the extreme opposite position. That there are knowledgeable experts who think that that's very possible, that we will never need boosters for COVID-19, because a lot of that is coming from more and more data that we get about the durability, the robustness and durability of response that we get, particularly from vaccination, but maybe to some degree from natural infection as well. That maybe it's more durable, more robust, and that it, one of the theories of why we would need boosters is that if the antibody levels drop off, then maybe you lose your protection over time. And there was early speculation that perhaps that would be needed on a 6-month basis or maybe yearly basis. But actually, the studies so far on antibody levels have now been going on 8 or more months, and the antibody levels are still high. So we know basically that if you have a robust response to vaccination, it lasts at least 8 months, because that's how long we've been kind of studying it. And so that's one bit of information, and there's separately information that maybe the level of immunity is more variable after natural infection and maybe not quite as high consistently, but it also may be quite durable to the same extent. And so that's one reason why some people think, well, maybe we're never going to need boosters. There's also scientific data that's been getting more and more published about a part of the immune system function that Dr. Jetmore and I have talked about a number of times, which is sort of the memory part of the immune system. I mean, the immune system actually has the ability to maintain memory of the pathogens it's exposed to. Even if the antibody levels drop off, there are other, the memory B cells, T cells, and what are called bone marrow plasma cells. These are 3 areas of the immune system that actually can retain a memory, have a memory function, and that can do things like, even if the antibody levels drop off, if you are re-challenged with the same pathogen, then that very rapidly ramps up antibody production again, or may activate the killer T cells, which is not antibody dependent immune system function. So these effects appear to be real. We were hoping that they would be the case, and there's scientific data that in fact these things happen. And for that reason, some people think that maybe the need for boosters is going to be less. Now the curveball in all this is going to be whether variants develop that really escape the immune protection, in which case we will almost certainly need boosters at some point. But whether that'll be something that you just get, irregularly as variants are identified that are outside the immune envelope enough that they're worried about them, or whether it's something that it'll just be a part of the annual influenza vaccination cycle. I know that at least one vaccine making a manufacturer is working on a combination influenza COVID-19 shot, so it would all be in one. Those are things that are still, the jury is out on, but the evidence is weighing towards more of that we can count on the immune protection lasting longer and being better than we originally feared it might be.
So this, from what you're reading, what you're understanding, this potential of putting a COVID and a flu vaccine together really wouldn't hit us for another year because it wouldn't
Right.
be ready for this flu season. It would be still
Well, possibly.
a year
I
from
don't,
this
I
fall.
don't know. You know, one of the areas of focus of the Biden administration in terms of how the FDA and CDC are being kind of reorganized and the priorities they're being given, let's put it that way, is to find a way to improve the turnaround time on the development of vaccinations. So if they can do that quickly enough, then what it will mean is that what it could mean is that this combination shot, if somebody develops it now and they have an improved system for evaluating new products like that, then maybe it could be available this fall. It's probably a little bit late in the season to expect that though, so I'm kind of with you. It'll probably be more like next year at the earliest.
So would it be a messenger RNA vaccine that they're working on?
I don't know. It might not be. I'm not sure which company it is. It's not one of the mRNA companies. And I don't think it's even Johnson & Johnson. It might be AstraZeneca, which is not approved. Their version is a viral vectored vaccine. It's not available in the U.S. yet. But I think it might be them that is working on this combo shot.
You're watching Ask the Doctors on WGTV Channel 11. Our guests are Dr. Thomas Huth, Reed Health, Christine Stenson, Wayne County Health Department. We are taking your questions on Facebook as well as on Twitter. Keep them coming. Let's see if we got another one we want to try to get to. What will the COVID vaccine do to a person with autoimmune diseases that already have inflammation issues?
To our knowledge, in general, there is not a problem particularly. But, now with, I haven't looked in the last week how many shots have been given, but it's over 240 million at this point shots given, and many of those are people with underlying health conditions that affect the immune system, including autoimmune disorders. In general, the rheumatologists recommend that all their patients with autoimmune disorders get vaccinated because they're more likely to have severe effects from COVID-19 infection. And there does not appear to be particularly a risk of side effects related to the vaccine. Having said that, always recommend that everybody's situation is kind of unique to them, so they need to definitely needs to be a conversation with their doctor about when and whether to be vaccinated, whether and when to be vaccinated based on their own condition. So I don't want to make a blanket statement that everybody ought to run out and get vaccinated. They need to make a phone call first to the doctor.
Are you thinking that from how fast the COVID-19 vaccines were able to come out, are we going to be able to see vaccinations for other things in the future work that quickly based on research that has happened in the past, or is this kind of a one-off?
I think that's the hope, actually, and that's part of why President Biden really wants the CDC and the FDA to work together more to have this improved process so that we can have quicker turnaround on vaccines. So instead of taking 5 years or more to develop under normal conditions, that they can be done much more quickly and have an impact sooner. And a lot of that is driven by concern about emerging infectious diseases. COVID-19 will not be the last one. There will be, the equivalent of H1N1 epidemics, which everybody kind of forgets about now, but that's what we were dealing with in 2008, 9, 10, somewhere around in there. But, so that's ancient history now. Everything pre-COVID is kind of ancient history now. It's like, prehistory. But
back in the olden days, with H1N1.
I think, but we're going to have more H1N1s or something. In fact, I'm just hearing about a flu virus that some people are concerned may rise to the level of an H1N1 type situation. It's called H10N1. Come to think of it, and we want to be able to respond to those. We want to respond to Ebola-like things or MERS-like things, and those will jog people's memories, I'm sure. So emerging infectious diseases are probably the biggest public health threat in the world, and I think it's very appropriate to say, how can we always improve our ability to respond? And you'd think after all the experiences we've had with MERS and Ebola and this and that, we'd have maybe done better with COVID-19. But we just got so overwhelmed. And, so the systems obviously can be better, and that's what they want to focus on. So I think that's a long-winded way of saying, yes, they want to be able to do that, primarily be able to respond to emerging infectious diseases. But I think that there may be other conditions that may be amenable to immunization. And you can even get outside the infectious disease area. There's a strong interest in particularly mRNA-based vaccinations to help treat things like cancer. So, we want to be able to turn these things around quicker and not take years and years and years. Meanwhile, people could be benefiting, and that is the objective.
You're watching Ask the Doctors. We're taking your questions on Twitter, Facebook. Drop them in on social media. Let's see if we can get one more in. As a fully vaccinated person, how safe are churches?
Take your
The
stab at
hush
it,
falls
Christine.
over the crowd.
As a fully vaccinated person, how safe are churches? I think we need to remember, the more vaccinated we all are, the safer we all are. So I would need more information about that. But I will say, as a fully vaccinated person, you're safer than an unvaccinated person in a church.
Yeah, so maybe it depends what the circumstances are in that particular church.
Yeah.
How closely are they packing people together? What are the activities? Are they doing any distancing and so forth? Mm-hmm. I can tell you at my church, we're still wearing masks. Everyone's asked to wear masks. Some of the distancing has been relaxed, but my wife and I sit in a part that still has pews roped off because we're not comfortable yet.
And you're fully vaccinated?
I'm fully vaccinated. You would think I should be like, hey, what the heck? But I think I mentioned before there was a study done that people who are vaccinated are much more likely to feel uncomfortable in social situations than people who are unvaccinated. And that's just because if you think enough of it to get vaccinated, you're obviously just a more cautious person. But I think it depends on exactly what the situation is at the church, so it's a little bit hard to make a blanket statement. But in general, the more that people are vaccinated, the more safer the situations are going to be, right, which is exactly what Christine just said.
The administration, the federal government is trying to push toward a 70%, everybody has at least one shot by the 4th of July. Does that, and they seem to be getting closer to it. Not necessarily here. I think in Wayne County, in Wayne County, I think we've kind of stagnated a little bit, and we're going to look at your numbers in just a little bit, and I'm not sure whether you have included that or not. But does that continued push make you feel any better about, as a country, where we are, and as a country, how we might be able to better fight what's left of COVID, so that some of the reopening, for lack of a better word in my mind, can continue, and normality is something that by this fall we really have a chance of hitting. Because I've heard, sitting in this chair for the last year, the variants pop up when the virus has a chance to mutate. If 70% of the people in the country actually have one shot, less mutation? Question mark?
Theoretically.
I'm checking for the theory. I'm looking for the silver lining here. Help me out.
Well, I think there's reason to be optimistic. about all that, and I've brought some information in our eagerly awaited data portion of the program to discuss that. The the rates are down. The new case rates are down,
Yeah.
and so we haven't talked about the scientific concept of the reproduction number, the R number, and so forth. But obviously, it's significantly less than 1 because the rates have been so far down, and there could be a lot of reasons for that. If that trend continues, and the two wild cards are variants, which could get into the country from elsewhere, and there are a couple of California variants that are on the CDC's watch list, in addition to like the UK variant and so forth. The Brazilian variant and the South African and Indian variants appear to be particularly virulent, and so those are of concern, but they're not significant portions in the U.S. So, the variants could be a problem. We hope not. And then I've said before, I think that there are some natural fluctuations in the way pandemics kind of roll out and unroll over time that we don't fully understand, and so there are things that we can't fully control that have an impact on whether there might be a surge. So there are wild cards, but if things continue as they are, I think we can probably chalk a lot of it up to general immunity levels in the population, which is vaccine plus whatever immunity comes about from infection, acute infections amongst the community members. And I brought some theoretical construct on that when we talk about the data.
Let's go ahead and move toward that. We're at that point. So if first slide, I guess.
Okay. For the first slide is the Wayne County and Reed rates side by side, generally covering more or less the same period. And you can see over the last few weeks, there's been a general decline, and we're at lowest levels now than either the county or Reed has had in quite a long time. This week should finish about 21 cases in Wayne County. Could be a little higher, could be a little bit less. You can go on to the next slide, guys.
We were having there at the peak, double 21 a day.
Yeah.
So to have,
Absolutely.
27
Next slide.
a week.
So the next slide is, these are the vaccination rates. If you focus on the left graph, Ryan, what we have there, the lowest line, it says RSA, that's Reed Service Area, that's Wayne County, and all the counties surrounding, including 2 in Ohio. So about a 9-county area that, in aggregate, sitting at, 32, 33%. And that was as of last Sunday, so they're a little bit higher than that now. Well under the Indiana rate of about 42, 43. Ohio a little bit higher than that. U.S. rate as of last weekend was just over 50%. It was like 51% of people have at least started on vaccines. So we're a little bit less than 20 points from that stated goal of 70% by 4th of July. It's doable, but it's going to take some effort to get those stragglers in my view. The right-hand graph is if you break out all of the counties in the Reed service area, you can see that Wayne County is a little bit behind Henry County at the top, but still amongst the best in the counties in the area. And Wayne County, as of Sunday, was about 36, 37%, had at least started on vaccination. And that's percent of the whole population. Sometimes you'll hear people talk about percentage of adults or percentage of above age 12, so you always have to kind of specify what the denominator is there, and that's of the easiest calculation, which is of the whole population. And Franklin County significantly continuing to lag, and we've done some things there to try to help them, and they have a number of, not just us, but Margaret Mary Hospital has done some things, and the local health department there has done a lot of particular outreach, particularly out into the most rural areas of that county, which is very rural. And now if we go on to the next slide, Ryan, and if you actually focus out a little bit, this is a theoretic sort of what if scenario. And so the question is, how much immunity is there? And you have to factor in that immunity is not just who's been vaccinated. It's what level of immunity is out there from people having had natural infection. And we got to talking about this earlier in the week in a phone call with Christine and some other folks, because there are beginning to be some editorials and scientific publications to the extent of, hey, let's not ignore people who've had the disease who have levels of immunity.
Mm-hmm.
We talk about immunity as though it's just who's been vaccinated, but we know lots and lots of people have had the infection. And the CDC estimates that only about 23% of total cases have been reported and made it into the statistics. So if that's true for Wayne County, and we know that there are a little over 7,000 reported cases in Wayne County, then actually the total cases in Wayne County should be around 30,000 have had COVID-19 and therefore have some level of immunity. Now we can't just add those to the 22,500 who've been vaccinated in Wayne County. They're Wayne County residents who've been vaccinated. We can't just add those together because some people who've had the disease also get vaccinated, so there's a level of overlap.
Right.
And it depends on how much you assume people who've had the infection get vaccinated in addition. We don't have reliable statistics on that, but we can make some guesses. And if you look at that table, you see what those guesses are, if there are certain ranges. That if you go back to that slide, yeah, so if we assume that 10% of people who have had the infection also get vaccinated, then that overlap means that a total of about just short of 50,000 people have some level of immunity. That would be about 76% of the Wayne County population, which is
There
a
we
lot.
go. That's good.
It's very good, actually. On the other hand, if we say, well, maybe more people who've had the infection get vaccinated, if we assume 25%, just to pick a number, that takes us down, because of that overlap feature. Mm-hmm. That takes us down to about 70%, 69%, technically, by the math. And now we know that the total vaccinations of 22,500 is about 34% of the population. If we assume that people who have had the infection get vaccinated at that same rate, 34%, then that takes us down to about 65% of the Wayne County population has some level of immunity. So I think that that's kind of the most likely range. Personally, it's just a guess. I don't think they're getting vaccinated at a higher rate than everybody else, because people who have not been vaccinated already are kind of resistant to getting vaccinated, and I would think that they're getting vaccinated at a lower rate. So I would say that's the upper end, the lower end being 10% also being vaccinated is a rough guess, and so we're somewhere between a 65 and basically 75% of the population of Wayne County may have some level of immunity if this logic holds up. And now, what kind of immunity is that, though? We think that the immunity that you get from natural infection is maybe not as robust and may not last as long. We don't know. That's the concern. And so we'd rather have everybody possible vaccinated because we know that level of immunity is much higher and appears to be really robust and long and durable. Mm-hmm. So we want more people to get vaccinated, but in actuality, we could be in that 70% range of total immunity at this point, even for our little old Wayne County, which is way behind the state vaccination rate. And and that's why I say maybe there's some reason to be somewhat optimistic anyway. And now we definitely want that to be higher. So I hesitate to even mention it because people could walk away with the message that I'm saying, don't worry about getting vaccinated, we're all fine. That's not what I'm saying. And I'm also not saying people who are not already vaccinated shouldn't worry about getting vaccinated. That is not the message. And if we look at the rest of my data, we can see why we need to concentrate on more vaccination. And if you bring that up, I'm following the data from Wayne County about over time, what are the age distributions of the new cases of COVID-19 that we're seeing? And it just happens that we have a marked change, a big change in the distribution along the age groups since about the 1st of April. Above age 70 is now only about 2% of the new cases. That's really different. That's typically been 15 to 20% of the new cases. But so far, since April, it's only 2%. Now, why the heck is that? Well, if you go to the right side of that page, you can see that people in those age groups are getting vaccinated at the 75% rate. That says to me that, that's maybe some evidence that a 75% vaccination rate for people who are at high risk actually confers very good protection. We're seeing very few cases in that age group now. Now, if we go to the next page of what I brought, you can see what it is we should be really switching our focus to. And that is, how sick are the people who are getting COVID-19? And I can only judge that by what we're seeing at the hospital, but I can tell you that in recent days, we haven't found really anybody amongst hospital patients who was fully vaccinated, was a true breakthrough case. Virtually everybody's unvaccinated who's been in the hospital recently. And in particular, of the very worst cases, 5 mechanically ventilated patients in the last 6 weeks, 4 of whom died. The things they have in common are that they're between the ages of about 55 and 65. Here, 57 and 67 actually was the spread. And they also had comorbidities, chronic conditions that put them at higher risk, obesity, diabetes being the two that every single one of these people had. And they're all unvaccinated. And when you look at the graph on the right, you can see that on average, they're vaccinating at about the 50% rate. So 50% vaccination is not protective enough. 75% may be. What we need to do really is everybody needs to get vaccinated because that helps protect the most vulnerable. When everybody, even the not vulnerable, get vaccinated. But in particular, we've got to get to more of these 50s and 60-year-old people who, particularly if they're overweight, particularly have diabetes, or they have heart or lung conditions. We've got to get more of them to be vaccinated. If they can get up to that 75% rate, like the 70-year-olds, then they they will probably be optimally protected at that point, in my view. So that's where we want to focus, I think, going forward, really figure out how can we get to more of these people, where are they, what does it take to get them vaccinated, and I know that at least for our part, Reed's part, we're going to take a harder look at people who are coming into our practices, try to get more of them engaged to be vaccinated. We did a study, internal study recently that on average only about 40% of our patients are getting vaccinated. And so that can be much higher. In addition to that, people who have these multiple conditions that put them at high risk also may be more likely to be in and out of the hospital. So we're going to work on identifying more of them to be vaccinated. It seems like it should be a simple thing, but it's actually quite complicated for reasons I won't go into. But we're going to focus on that.
Well, and to...
We've got about 3 minutes left, just so you all know.
I just wanted to piggyback on what you were talking about in hospitalizations. The state released some data statewide of people that are hospitalized in Indiana. Only 0.05% are unvaccinated. So...
Are vaccinated.
Or vaccinated, I'm sorry, yeah. I said it. That's why he's here. He keeps me straight. Yeah, so 0.05% are vaccinated. So getting vaccinated is one of the things you can do to keep you out of the hospital. But I will tell you, I recently had a fall and had to have surgery and have been to the doctors. Not one time has the doctor asked me if I'm vaccinated
Right.
or anything like that. So I do think that that's a really good time for people to hear it from a doctor, you know. Hearing it from the health department is one thing, but your trusted physician, someone that you trust implicitly, you know, asking you, have you gotten vaccinated, might be the hurdle that we need to overcome on these vaccine hesitancies.
We've got just a couple of minutes left. I'm going to kind of give you the last word. You're here. We're heading into, this is commencement weekend all around Wayne County.
Yeah.
What do you want people to know as they kind of do that quick break for the summertime?
Yeah, enjoy the summer, enjoy time outside. Don't let your guard down. Outside activities are safer than indoor activities. Watch the ticks, watch the mosquitoes, keep your, you know, don't breed your own troubles there with your property. But we can talk about those on another time. I could talk about mosquitoes and ticks for hours. So
We'll do it in focus on mosquitoes,
Yeah.
ticks, and stuff like that.
there we go. Bats and dogs and all kinds of things.
Okay. Animal bites a lot this time of year.
Everything increases in the summertime, not
Okay.
just the fun.
We'll
I
deal
could talk
with a
about
lot
swimming
of that.
pools. That's the thing. That's all the pools are opening up. Boy, we
Yes,
just
they
got
are.
hammered with requests to have the opening inspections for public pools and semi-public pools. So it's going to be a good weekend.
Isn't
It's
that
going to be a
great
good weekend.
as opposed to last year?
Right? Yeah, yeah. So enjoy the weekend. Don't let your guard down. Get vaccinated.
All right. Christine Stinson, Executive
you.
Director, Wayne County Health Department, thank you very much for being here. Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health, as always, good to see you.
It's a pleasure.
I just mentioned it is commencement weekend, so congratulations to all of the families and all of the kids. There's one in particular we need to mention, Colby Cox, who is a intern from Seton High School here. One of the things we ask our interns to do is kind of create a program, and Colby talked to 3 local not-for-profits. He put together a program that we are going to air Saturday evening at 7 p.m. on WETV Channel 20. It's called Local Compassion. Tune into it. It's really a good time, and congratulations to Colby and all of the graduates this weekend. Thank you very much for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook. I hope you will join us again next Tuesday afternoon at 2 p.m. as we do this all over again. I think Dr. Jetmore will be here, but it depends on riding weather. As always, I wish you well. Take care.